Hello, everyone, and thank you for joining today's webinar, Re-Engaging Parents in the Workforce, a Tribal TANF Perspective. We are very excited to have all of you join us today to hear from some very great presenters to discuss this topic with you. I'm James Butler, and I serve as one of the Family Assistance Program Specialists in the Office of Family Assistance within the Administration for Children and Families. Before we get started, I'd like to just review how to submit questions using the Zoom webinar platform, since all of the participants will be muted. As you'll see in a few seconds, as the screen pops up, at the bottom of your screen, you will see a Q&A icon. You can click on the icon and that will generate a question and answer box where you can type your questions. Please note that your questions will not be visible until they are answered, and then you can feel free to submit as many questions as you'd like, and they will be visible afterwards, as mentioned. Throughout the webinar, you can, if you have questions, if you have it for a specific speaker or presenter, you can also indicate that as well. And we will monitor your questions and address them during the Q&A session. We're also going to launch a few polls throughout the presentation. They will pop up on your screen automatically. And also, we will also have an evaluation poll at the end of the webinar. You can respond to the polls by clicking on the radio button next to your preferred response. And we will leave each poll open for approximately 30 seconds. And then we will share your results overall. Today's webinar will be facilitated by Louisa Jones, who serves as a Senior Director with ICF and has provided training and technical assistance for education, TANF, workforce development projects for all states, territories, and tribal programs. She earned her bachelor's degree from the University of North Carolina at Chapel Hill and her master's degree in international education development from Teachers College, Columbia University. She's currently pursuing her MBA from the State University of New York at Oswego. Ladies and gentlemen, I now present to you Louisa Jones.
Thank you, James. Good afternoon, everyone, and good morning to some of our participants who are on the West Coast or further. So if we can do next slide. Our webinar today is going to have three different pieces. We're going to have individual presentations from 4 speakers. We're also going to have some polling questions interspersed amongst our speakers. And also, as James mentioned, we're going to have Q&A from our audience, and you can continue to submit those Q&A as our presenters talk, and we will get to those questions and answers later. So today's webinar, we're really going to focus and explore the economic and workforce impact of the COVID-19 pandemic on TANF participating families, with a special focus on Native families and also mothers who've been the hardest hit by job losses and school shutdowns. As part and parcel of this conversation, speakers are going to discuss the critical role that affordable childcare plays in the ability of parents to participate in the workforce. And we're also going to highlight several federal and state childcare resources that TANF programs can coordinate with to support their families. And as I mentioned, you're going to hear from 4 speakers today. We first have a labor market economist who's going to set the foundation for our discussion and presentation with this overview of the state of employment and challenges for working families, specifically those of color. And then following that, we actually have 2 Office of Child Care representatives who are going to share how TANF programs can coordinate with child care programs and offices to really expand and streamline services to their participants. And finally, we have a speaker from Cook Inlet Tribal Council in Alaska who's going to provide an overview of several of their family strengthening programs as they relate to TANF, and also providing tools for families to really rely on to survive. So as we mentioned, we're going to launch several different polls, and we're going to leave the polls open for about 30 seconds after that. So for the first polling question, is which of the following best describes your organization? And you're just going to want to hit on the radial button if that's ready to go. Okay. Tribal TANF, state, National Families Social Services Program, Child Welfare Organization, and Workforce Development Program. So we're just going to give you 30 seconds to answer that. Okay, looks like we have almost an equal percentage from tribal TANF programs and some state TANF programs, with a few from workforce development programs and social services programs. So if we can go back a slide, I'm just going to introduce our 4 presenters all at once, and then we're going to jump into the first presentation. So we first have Matthew Gregg, who is a senior economist in community development and engagement, where he focuses on research for the Center for Indian Country Development. He's contributed to the analysis of a series of surveys developed by the Federal Reserve Bank of Minneapolis to really understand how the pandemic has affected employment, revenues, and costs. He has also published a paper on the current state of the tribal digital divide, and he's working on generating a database on tribal enterprise formation, which focuses on diversification and employment options in tribal communities. Next, we're going to hear from our 2 Office of Child Care representatives. Ms. Xenia Haynes, is a program specialist with the Office of Child Care within ACF Region 5 in Chicago, Illinois. She's been part of the ACF family for about 22 years. She's currently working on an infant mental health certificate and also a credential in an effort to elevate and advocate the importance of social, emotional child development and mental health well-being. She hopes to use reflective supervision and consultation to expand capacity for those in administrative roles and embed reflective practices into systems that support young children. She's joined by Dr. Lisa Blackman, who's a program specialist with the Office of Child Care within ACF, Region 6 in Dallas, Texas. She has served in this capacity for over 18 years and provides leadership and guidance to support early childhood initiatives across ACF. During this time, her involvement in various programmatic and fiscal aspects of OCC includes several special projects and duties focused on grant administration, TA, research and evaluation activities, interagency and regional office coordination, state and tribal CCDF collaboration, and oversight of construction and renovation of tribal childcare facilities. And our 4th and final presenter, Ms. Deborah Northberg, is the Senior Director of Child and Family Services at Cook Inlet Tribal Council. At CITC, Ms. Northberg works closely with other social service providers, including TANF, as well as the state's child protection system, to reduce the disproportionality of Indigenous children in the child protection system. Over the last 10 years, her work has focused on developing and sustaining partnerships to support prevention of child abuse and or neglect, early intervention for at-risk families, and interventions that improve economic stability of families. So without any further ado, I'm going to turn this over to Mr. Matthew Gregg, and we'll start this conversation.
Thank you. Let me quickly, hi, my name is Matt Gregg, and let me quickly just underscore what the Center for Indian Country Development does. We're the only policy and research center within the Federal Reserve System that focuses exclusively on issues of importance to tribal economic development. So we've been in a center for roughly 5 years, and that's our goal. So for this presentation, I'm going to provide some aggregated statistics on the impact of the pandemic on females in the labor market, and then I'll move to the impact of the pandemic on working mothers, and then provide some data on early care and education across income and racial groups, both before and after the pandemic, and then summarize some of the work that the Center for Indian Country Development has done to better understand the impact of the pandemic on American Indian and Alaska Native communities. Some of what I'll say will likely corroborate with much of what you know or have seen reported in popular press, but some may be corrective. Next slide, please. If you don't mind, feature eyes on this disclaimer. The views that I'll present are my own and not those of the Federal Reserve Bank or the Federal Reserve System. Next slide, please. Okay, so the labor market has been in flux for more than a year and a half since the start of the COVID-19 pandemic. And in typical recessions, men bear the brunt of the initial layoffs because in a typical recession, when incomes fall, demand for goods falls, and men are disproportionately work in manufacturing sector, which gets hit the hardest. That is not the case for this pandemic. To put things in some perspective, in the mid 2019, I think it was, I forget the exact month, but in 2019, a milestone was reached for female participation in the labor force, where the majority of all non-farm payroll jobs in the U.S. were held by women. Well, because of the nature of the pandemic, women who are disproportionately working in service sectors, in particular low-wage service occupations, were most hard hit by the recession. And so women in general were more likely to be laid off or to work in dangerous conditions. On top of that, during the start of the pandemic and throughout this pandemic, of course, childcare availability has decreased. The number of childcare workers has fallen by 34% since the start of the pandemic. That's because childcare centers, some of which have closed, parents have also removed children from childcare providers as well. And thus the pandemic has really increased the role of caregivers. And according to the CDC, in the US, 2 out of 3 caregivers, and this is caregivers towards children and also elder care, are women. Next slide, please. Okay, this slide gives hopefully a nice visual of the disproportionate effect of the pandemic on female job loss. So as I mentioned, the non-black lines, like the purple, the blue, and the yellow, represent past recent recessions. And in those past recent recessions, women's employment has declined noticeably less than males, and women employment levels returned to the pre-recession levels many months before that of males. Well, if you focus your attention on the black lines, you'll see on the left is the male effects of the pandemic, and on the right, the female effects from the pandemic. You'll see that women's employment declined substantially more than men, and the recovery has been slower for women than for men. So this is a very unique, the pandemic has created a very unique recession and response. Okay, so women, like I've said, has borne the brunt of the job loss, not just at the start of the pandemic, and the reason, of course, is that women are, of course, more likely to work in in-person work. Labor economists refer to those as pink jobs. Next slide, please. That's just one way to measure the impacts of the pandemic on women. And here's maybe a better way. Here's some data just on working moms and their effects, the effects of the pandemic on their willingness to work, their willingness to stay in the labor force, the willingness to reduce the amount of hours they work per week, etc. So this is data collected by the WIGI. This is a survey of about 3,000 working parents. And the purple lines reflect the working moms' answers to various questions in the survey, and then the green lines are working fathers. And you'll see that if you look to the fourth kind of column, you'll see that this pandemic has seemingly changed the way women are returning to the labor force. They are about a quarter of the folks in this survey, a quarter of the women in the survey have either dropped out or reduced their work since the start of the pandemic. And that's compared to about a fifth of the working fathers. Next slide, please. Okay, and but that's just some of the labor force impacts of the pandemic. Another way to think of the impact of the pandemic on working mothers is to look at what's happened before and after the pandemic in terms of participation in early childcare and education across both income groups and also minority communities of color in particular. So what this data tells us is that before the pandemic, the folks that answered yes to each question well, it depends on the question, but it's if you answered yes, you're either by the definition of the survey, lower income family, or you're Black, Latino, or you have both parents have do not have a college degree or do not have a 2-year degree. And this just shows you that before the pandemic, there was already these gaps between high income and low income families, and with respect to sending their children, in particular 4-year-olds, to a pre-K, an early care education center. And excuse me, the pandemic has most likely, as the data is collected, exacerbated these gaps. Okay, so why is there relatively less participation for Blacks, Latino families without education, lower income families in ECE enrollment? There's a handful of reasons. They're on the excuse me, on the right. In the US, early childcare is relatively expensive compared to most other countries. Some lower income families have to travel long distances, and the US doesn't provide subsidies to early childcare like other countries. Next slide, please. Sorry for the cough. That was poor timing. What do we know about the effects of the pandemic on early childcare and education participation since the start? And so a silver lining, maybe this is a stretch, but a silver lining of the pandemic is that it's caused folks who are interested in using data to better understand these kind of aggregated effects of the pandemic, to look at all non-traditional sources. This particular figure is based on tracking people by their cell phone movements. And what we found is that, of course, at the very start, when 2/3 of childcare centers closed during lockdown or shutdown, you see a huge drop in participation in early childcare centers and visiting, and basically visiting early childcare centers. And we've seen that it's been steadily increasing, but it's still not at the same levels as before. So why is that? Well, there's of course still safety concerns. There's still some families might be sending their child to schools where there's still distance learning. There's an income effect from the recession. And then it's been a challenge for many childcare centers to hire new workers due to the kind of dangerous conditions. Next slide, please. All right, I haven't mentioned anything about American Indians or Alaskan Natives. This is, of course, the focus of the Center for Indian Country Development. One of the reasons is that national data sets are not, they don't oversample rural, smaller communities, like where not all, but many American Indian, Alaskan Native communities are located. And as a result, we're kind of left to looking at broad-based measures of race. So what we have done is we've noticed that the data suggests that American Indian, Alaskan Native communities may have, or likely disproportionately affected by the pandemic. One measure, the age-adjusted COVID deaths are the highest for the American Indian, Alaskan Native community, even though vaccine rates are incredibly high for the same community. But in terms of non-Hispanic whites and blacks and Hispanics, the highest age-adjusted COVID death rate pertains to American Indian, Alaska Native population. Of course, many tribal communities rely on gaming and rely on hospitality. Those are the sectors that were most hit by the pandemic. And so through surveys from the CICD, we've noticed that on average, revenue loss from the start of compared to pre-pandemic levels have dropped by 40% across surveyed participants. And we also pull out some American Indian, Alaska Native information from the Consumer Population Survey, and we see that at the peak of the trough of the pandemic in spring 2020, the unemployment rate for that community was almost 19%. It's still at relatively high. It's responded a little, but it's still at relatively high levels at roughly 9% in September 2022. So, and then the last thing is that unfortunately, the goal is to, I've mentioned this before, this is for a bigger issue, but there's these data gaps in American Indian, Alaska Native communities. The data that we measure, the pandemic effects can't be split up any further into just broad categories for American Indians because they're not oversampled. So some of this stuff that I've said masks the heterogeneity of what's happening in Indian country. Some areas might be much more harder hit than I've described. Some areas have been able to maybe use some federal funds to benefit the community quicker than others. So some of that heterogeneity, unfortunately, cannot be addressed in this call because of the dearth of data on American Indians and Alaska Natives in general. Next slide, please. I just want to end on this point. One thing we've done at the CICD is just to ask tribal governments which services they've had to cut because of the loss in tribal enterprise revenue and some of the uncertainties with the original CARES Act money and how that should be spent. And buried in the middle of that slide is the social services, which we see that tribes, and this may corroborate or maybe not consistent with some of the people who talk on this panel, but we see just on average, for at least the folks that have participated in this in our surveys, that tribes have prioritized services. Elder care, social services have been prioritized above some of these other services that need to be cut, like recreation or economic development grants. And so tribal governments are in a sticky situation where, unlike state and local governments who can rely on property tax and all these other venues to increase their tax base, the tribes are left kind of almost fending for themselves, using tribal enterprise revenue to support social services when casinos and hotels were closed. Those were obviously hit hardest. Next slide, please. Okay, well, that's all I have to say. I wanted to provide a general overview of what we know from a data perspective of the effects of the pandemic on women in general, and in particular working moms in communities of color and Alaska Native, American Indian Alaska Natives. So thank you for your time. Look forward to answering some of your questions in the Q&A.
Thank you, Matthew. Matthew, if I can, I was just going to ask one additional question. Did you see anything in the data, kind of in addition to child and other family care? Are there other factors that maybe have contributed to women being disproportionately unemployed during the pandemic?
Well, I mean, the biggest factors are the services that were most hit. So hospitality, healthcare, these are sectors that were most employed by women in general. They're called, like, those are sectors where soft skills are more valued, and so to me, from my reading of the literature, the sectoral effects are the driving reason behind those declines in female employment.
Thank you so much. So, and thank you for providing that nice overview. And I know we have some questions kind of coming in, so we'll get to those during the Q&A section. So I'm going to jump to poll question number 2 before we go to our next set of presenters. In your area, what is the greatest challenge to engaging parents in the workforce currently? And that means in either your state or local community. Let's give it a second. Okay, I think this backs up what Matthew was talking about. Some of the greatest challenges, about 56% childcare, and then going into limited skills and education, transportation, and then some behavioral health challenges and then other. So thank you all for your response. And I'm now going to let you all hear from Xenia Haynes and Lisa Blackman.
Okay, there I am. Good afternoon, or good day, because it may not be afternoon for some of us yet. Can you hear me okay?
Yep, you're great.
Fantastic. All right, so again, my name is Xenia Haynes, and I am a program specialist with the Office of Childcare in Region 5 Chicago, and I am joined by Senior Program Specialist Dr. Lisa Blackman, who's from our Dallas, Texas office in Region 6. And together we're planning to share some information pertaining to the support provided to working families through the Office of Child Care. But before I really jump in, I like to give a proverbial hats off to the collaborators of this meeting and the foresight in bringing all of us together for this information session, because the intersection of childcare and the TANF programs is too often overlooked in discussions that are about meeting the needs of low-income working families. Now, before the pandemic, we knew the important role childcare had, but we gained a much deeper insight on how access to childcare is essential, not only to parents, but also to employers in their effort toward getting the economy back up and running. And Matt's presentation just gave us so much more insight into some of the things that we're dealing with. Within this, there's definitely a tie to both TANF and childcare's goal of supporting low-income families. So childcare is a critical component of financial security for families that allows parents to find and keep stable employment while ensuring children have the benefits of quality childcare that results in a strong foundation of success in school and life in general. So TANF is one of our country's primary safety net programs intended to support low-income families and their children on a path towards self-sustainability. And I'll use childcare and CCDF interchangeably, if you don't mind. So CCDF and TANF have a long legislative history that began with the Family Support Act of 1988. And this required states to guarantee childcare services to families receiving what was at that time called aid to families with dependent children. And if you know that term, you've been around a while, as I have, which is a good thing. But now through collaborative efforts, these two programs can create a two-generation approach to assist families in the achievement of long-term economic independence. Oh, and I'm sorry, I should have asked for the next slide. And this slide just talks about the different ways TANF and childcare work together to meet the needs of working families. And we're actually ready for the next slide. So one of the advantages of CCDF and TANF is that lead agencies have flexibility in the design of their programs when creating structures, policies, and practices pertaining to access to service and resources that meet the needs of families and children. There are many strategies CCDF administrators can use in creating effective and efficient collaboration between program administration and service. And I'd like to share a couple of those. So some of the strategies of note are the development of a streamlined application process for families, the sharing of data across agencies and programs for both initial determination and for receiving updates about changes, the establishment of procedures for families to move seamlessly between TANF and CCDF childcare assistance, the establishment of uniform childcare payment rates that support access to a full range of childcare providers, the establishment of uniform health and safety standards for all licensed, regulated, and registered childcare providers, and to the extent practicable, creating an alignment of eligibility policies between and across programs, and strategies for the development of a coordinated consumer outreach and education system, along with strategies to educate families on the availability of cash assistance and childcare services. And really, I think most importantly, providing all families with access to information in a meeting them where they are frame of mind. So in addition to sharing strategies that CCDF administrators can use, we'd also like to share information on financial support for the stability of the childcare sector as a whole during and after the COVID-19 public health emergency. Congress awarded approximately $24 billion to the CCDF program with the goal of providing financial relief to childcare providers to help defray unexpected business costs associated with the COVID-19 pandemic and to help stabilize their operations so that they may continue to provide childcare. Additionally, Congress awarded supplemental funds to the CCDF program through several COVID-19 relief packages, which have different flexibilities and restrictions and or relief from some of the normal CCDF fund rules. So at this point, as we change the slide, I would like to turn it over to my colleague, Lisa Blackman. Thank you.
Thank you, Xenia. And I just wanted to do a sound check. Can you hear me?
Yes, thank you.
Okay, thank you. And thanks everyone for joining us today. I'm joining you from Dallas, Texas, with some unexpected inclement weather and some high winds. So that's one of the reasons we have elected not to start our audio today, but I am connected through audio. We did want to just take an opportunity to share with you and to help you understand some of the multiple COVID-19 funding requirements and allocations that were provided to CCDF programs. And as Xenia mentioned, CCDF is awarded to state, tribal, and territories. And so we'll refer to them as lead agencies. We'll also provide some specific examples that relate to tribal lead agencies, whether they are direct funded or they receive child care through a consolidated plan through a 102477 program. So if you have any questions related to either a state, tribal, or a direct funded or 102477, we do want to just make sure that we are able to engage all of those that may be represented. And if you'll take a look at the handout that's available, and it will be made available afterwards, just wanted to give you an idea of that Congress awarded the additional or the supplemental funds that Xenia had referred to the CCDF program through several COVID-19 relief packages, which included CARES, CRSA, and the ARP Act. These funds, which do have different flexibilities and restrictions from the regular CCDF funds, can be used to respond to the COVID-19 pandemic while also carrying out the regular activities of CCDF. There are 4 different funding streams that were released. They are illustrated on the handout. One of the funding streams was awarded during grant year 2020, which is also known as the CARES Act. The other 3 funding streams were released in grant year 2021, which included CRSA and then the 2 ARP Act funding streams, which also we refer to as the ARP supplemental or discretionary, as well as the ARP stabilization. And this handout is available on the OCC website, as well as the childcare TA website. And it does explain the different COVID-19 relief funding streams as an overview that can be shared. Next slide. Along a strong, stable early child care and education workforce is essential to economic recovery, a child's learning and development, and the overall family well-being. The early childhood programs across the country have faced unprecedented shortages of staff, a problem that existed both prior to and was exacerbated by the COVID-19 pandemic, which also was shared and referenced with Matt's presentation. The childcare industry is down, even more so prior to the pre-pandemic levels, and childcare staff hiring is more challenging than ever. And in looking at expanding access to childcare, we'll look at families, childcare assistance related to essential workers, as well as more of an administrative focus of data system sharing. Some of the things that we do know is that most parents can't afford the true cost of providing care. Childcare workers are among the most underpaid in the country. There's high staff turnover rates, which lessens the quality of care, and it disrupts the stable relationship between the children as well as the providers, and does impact and increase the business expenses. The instability that is caused by low rates and low wages results in an unstable childcare sector without enough childcare available for families in many communities. And I think that that was also a realization that was captured on the results of the poll, of the second poll question, is that childcare seems to be a barrier with employment or regaining employment or maintaining employment. Many don't earn enough to make a living wage, and nearly half rely on public income supports. And this makes it difficult to recruit and retain a high quality workforce. The lack of childcare options costs the U.S. economy billions of dollars each year in lost earnings, productivity, and revenue. And as we all know and have identified, childcare is an essential part of the response to the COVID-19 pandemic, as well as subsequent recovery efforts. The CCDF fund, which, as I mentioned too, is awarded to states, tribes, and territories, continues to provide funding to those governments during the pandemic to provide the support to the children and families with paying for childcare. This is an important opportunity to address the childcare crisis and to rebuild toward a stronger system that allows parents equal access to high quality childcare and supports the developmental and learning needs of children. It also meets the parents' employment and childcare preferences. And it also supports a professionalized workforce that is fairly and appropriately compensated for the essential skilled work that they do. Some of the priorities of the supplemental funds is expanding access to childcare assistance. Some of those activities include supporting families struggling to afford childcare or facing job interruptions or income loss, childcare assistance for essential workers, as well as data systems to support equitable access to childcare. And additional activities using these funds, such as mental health supports, outreach on the availability of childcare assistance, as well as supporting vaccinations, are also encouraged. This information is clearly defined within program information memorandums that have been made available to lead agencies, to county and state governments, as well as coordination and collaboration among early care and education, Head Start, child care, home visiting, as well as pre-K programs. So we do recognize that we refer to it as child care, but also it does impact not only child care, but then also the supports for school age, for after school care, for summer care. So we did just want to share some of those differences that may be impacted, and they continue to create challenges for parents as they either enter or maintain their employment. Next slide, please. Okay. In continuing the discussion about expanding access to high-quality childcare, guidance pays particular emphasis on increased provider payments as a key to meeting the goals on equal access and staff wages that attract and retain the professionals to help to drive the quality, as well as to increase the supply in low resource areas. This is strategies to reflect this are increasing the provider payments, as mentioned, improving the policies, increasing the wages for early educators, as well as family child care providers, and building that supply for the underserved populations. Lead agencies, state, tribal, and territories, were encouraged to take immediate action to supply the relief to the existing workforce and to address the crisis of the turnover. The federal funding and the supplemental funding can be used to help to recruit, to keep and sustain the local childcare market. Turnover is a major obstacle in the delivery of childcare due to the low pay and no benefits. One of the flexibilities of CCDF is that the lead agencies may pay childcare staff based on a child's enrollment rather than attendance. Many lead agencies support the fixed cost of child care services by delinking those payments from an eligible child's occasional absence due to holidays, unforeseen circumstances such as illness, pandemic, and other related absences or interruptions in the care of that child. Also, lead agencies through the supplemental funds of the ARP stabilization funds may incentivize subgrant recipients to implement certain policies, including higher pay for staff. Child care providers must certify, though, that they will pay at least the same wages and benefits to the staff during the duration of that subgrant. Therefore, while providers may choose to increase pay or offer bonuses for their staff in order to take advantage of these incentives, the provider may not opt out of continuing to pay their staff at least the same wages. Next slide, please. In expanding access, we also want to look at the wages for the child care workers, as well as identifying and increasing the supply to the underserved population, as was previously mentioned. Lead agencies are encouraged to quickly distribute the funds to protect the existing child care market and to provide significant flexibility in designing that grant or sub-grant program. The federal investments in early childhood are key to our nation's economic recovery from the pandemic. It's also crucial to provide critical infrastructure for parents to work or to pursue the training or education while their child is in an affordable, safe, nurturing, as well as educationally enriching environment. Some of the strategies that the lead agencies may use to support the early childhood workforce in the short term include to improve the child care subsidy payment rates, to increase staff wages or provide one-time incentives such as hiring or retention bonuses, provide benefits such as paid leave, health insurance, child care, and retirement benefits, to also consider funding scholarships and time off for training or enrollment in educational coursework. Expand shared services models such as substitute pools and family child care networks. And overall, providing staff wellness support, such as guaranteed breaks, access to mentoring and coaching, mental health consultations. So it's very important to address not only the shortages and how you can help to not only to sustain and maintain the child care industry, but then also ensuring that you are providing the support needed for the mental health of those providers, as well as the families, children and families too. Next slide, please. We wanted to just share with you, and you can advance to the next slide. We wanted to share with you that something that is very specific to tribal CCDF is that funds can be used for construction or major renovation. This is a very distinct difference between what states and territories may be allowed an allowable use of funds. Tribes can use their regular CCDF funds as well as any of the supplemental funds or a combination of the regular and supplemental funds to support a construction or major renovation project. But we do want to note that the ARP Act stabilization funds are meant to support the child care sector, both during and after the COVID-19 public health emergency. And the way that tribes can access and utilize the CCDF funds, whether it be the regular funds or the supplemental funds. And again, this does apply to the direct funded as well as the 102-477 lead agencies. If it is a separate application process, it must be used to develop or construct a facility to provide childcare services for eligible tribal children that are within the service area, as well as their definition of an eligible Indian child that's identified within their CCDF plan. It is a separate application process. There are not additional funds to support this, and it is not a competitive process. So tribes work very closely with their regional offices to help to determine what is the best need. It is based on a lack of existing resources or facilities or quality facilities within a defined area. Also, one strategy that may be considered as part of the ARP Act is, as far as for the stabilization of maintaining the workforce, is that this will create extra jobs, that this does create an opportunity for training and employment for providers or those that may be interested in early childhood education and care. And so we will have information available related to the differences about this kind of unique opportunity that, again, kind of embodies all the areas of CCDF, of providing the care, the training, the employment, as well as a facility to meet the specific needs of the tribal community. Next slide. I believe that we will hold questions until the very end during our Q&A, but we did have some resources that we want to highlight for you to ensure that you have this information and just want to help you to navigate through the Office of Child Care website and the TA website, because there were a series of implementation guides that were developed that address each of the supplemental funds, as well as question and answers, frequently asked questions that applied to states, territories, and tribes. So we just wanted to make sure that you have access to this, and we wanted to highlight that the most recent funds that were awarded were the ARP Act, the discretionary or the supplemental funds. There's information memorandums, information regarding stabilization grants. There is a dedicated stabilization grants webpage. Resources are available as well as sample applications. Next slide. The other set of resources refers to the ARP Act Stabilization Subgrants, including application tips, considerations, and sample forms. And as I mentioned, there are some that have been modified for states and tribes. There's also a checklist regarding the requirements for posting the applications and the subgrant applications. And at this time, I will ask for Xenia to walk you through some of the remaining resources.
Okay, next slide, please. So in the spirit of collaboration, the Office of Child Care contributes to an effort that brings together resources from the Office of Child Care and the Office of Head Start and their health partners. The Office of Child Care has a technical assistance website where grantees and stakeholders can find information, tools, trainings, and other supports. And not so good at doing two things at one time. So when I stop speaking, I will put that the link to the Child Care TA. I'll put that in the chat for you. But you can see an example of some of the resources. And also, so the slide was advanced, there are also resources about grant allocations. And you can find total grants given for a specific fiscal year for states, for tribes, and for territories. In addition, there's also guidance from the CDC for opening child care centers and programs safely. And I will also put the link to where you can find the allocation, the grant allocations. I'll also put that in chat once I'm not speaking. I think that's it. Next slide, please. Yeah, and this is the one that has the guidance for operating childcare programs by CDC and other COVID-related resources. And some are general and some are specific to tribes, but the resources are there. And that's all we have from the Office of Child Care here. But of course, once we get to Q&A, we are very open to your questions. Thank you.
I'm going to jump in with one question before we go to Deborah. And thank you both so much for your presentation, because this is kind of really good information and a lot of really wonderful resources. I was wondering, have you seen a shift, moving into 2021 and wages or benefits for childcare workers as a response to the pandemic and difficulty finding employees now that more people are starting to go back to work and employed? Have you seen a shift in the wages or benefits or hearing about it?
And Lisa, I'll take that if you will. So yes, we definitely have. As some of the data that Matt shared and some of Lisa's presentation, we knew before the pandemic that there was an issue with wages for childcare providers, and it has been an issue with retaining, because you need a living wage. They have families, they have expenses. But to your question, yes, lead agencies, those who run their childcare programs, can incentivize subgrant recipients to implement certain policies, such as higher pay for staff. Again, as Lisa went over, we asked that childcare providers certify that they'll pay at least the same wages and benefits to staff for the duration of the subgrant. Therefore, while providers may choose to increase pay or offer bonuses for their staff in order to take advantage of these incentives, the provider may not opt out of continuing to pay their staff at least the same wages. And we think this is one way where we're trying to move the needle, even if we're trying to move the needle. I'll leave it there.
Right. Thank you. Thank you so much. Well, we're going to hear kind of more from a local perspective, and we're going to hear from Deborah Northberg. Deborah, take it away.
Thank you so much. And we are honored to round out this presentation as a provider of social services. I'd like to introduce our organization in order to give you a little bit of context about our collaboration story. So I'll build on some of the collaboration efforts that Xenia described within our community and context. So Cook Inlet Tribal Council is a tribal social service provider, and we are located in Anchorage, Alaska, which is the largest hub city in Alaska. And we are one of the primary points of in-migration and out-migration for Alaska Native peoples across the state of Alaska. Next slide, please. I'd like to show you where we are located. If you look in the little square, Anchorage is right in the inlet there, and we have a very broad service area as a nonprofit service provider arm of our for-profit corporation. The Cook Inlet region is one of the 13 corporations established in Alaska's land claim settlement. So you'll see that our service area is broad, but we provide services to any Alaska Native or American Indian person who is living in Anchorage, and some services beyond Anchorage within our local tribal communities. Next slide, please. We offer a very broad array of services within Cook Inlet Tribal Council, and which positions us to work very deliberately around collaboration and integration of services. That's been a long journey for us. And so in our employment and training department, we offer workforce development activities, GED preparation, tribal vocational rehabilitation, and most importantly, a Tribal TANF program. In our child and family services, we offer a broad array of early childhood development, prevention services, and for the longest time, more importantly, provided child welfare services, family preservation, family reunification, and family support. We have a recovery and reentry department that provides an array of assessment, outpatient and inpatient services, in addition to a reentry program for men at this point transitioning out of incarceration, and our education and innovation programs focus on providing direct instruction in a pipeline of schools in Anchorage with a high concentration of our Alaska Native population living in Anchorage, as well as many after-school enrichment programs. We operate a Fab Lab and the Native Youth Olympics. So our partners and under our umbrella as subsidiaries, we have the Alaska Native Justice Center that does work around supporting tribes involved with citizens involved in the state's child and need of aid court system, as well as reentry and services that are supportive of victims of domestic violence. We operate the Claire Swan Early Learning Center through our subsidiary, and this is an early Head Start program. And we have a for-profit arm that is CEI and Eline Media, and we develop video games and other products for sale. Next slide, please. So as I mentioned, in our employment and training department, this is the department that has historically been focused on supporting self-sufficiency. And CITC, as a tribal provider, is able to implement these services in a very strengths-based, holistic way in order for us to help individuals reduce barriers and either increase their skills training and to prepare for workforce entry, or directly access services that support work readiness, such as resume building and interviewing skills, those types of things. So over the years, we've developed a very broad array of supportive services in order to help individuals move toward that. One really important way that we do that is through our employment supportive services. We have a history of working with employers in the community, supporting participants to do subsidized work experience, as well as volunteer work experience and on-the-job training. And we operate many vocational training programs that are short-term, as little as 4 weeks, up to 60 weeks, and really tailored these toward what is relevant here in the state of Alaska in our community. So you'll see short-term programs such as truck driver, oiler, admin assistant, and our longer-term programs, including business administration, and we've had a focus on healthcare for some time. So these are the direct skills building programs that support work readiness. Next slide, please. What we've learned over the years in thinking about not just helping individuals enter or re-enter the workforce is, in order to retain employment, many of our, we call them participants, have struggled with ongoing barriers, and particularly skills development around kind of soft skills, all the things that help us manage our work-life balance and family. And so thinking about a whole family approach, we've developed a really robust suite of soft skills development services within our employment and training. Importantly, communication techniques, as important, helping people who are coming in from more rural areas to recognize and describe what are some transferable skills in subsistence, for example. How does that translate to skills here in the more urban hub? We focus on budgeting to reduce stressors, as well as how you function in a workplace, how you set goals for yourselves. And we offer healthy relationships and parenting skills, both in our work, in our employment and training department, as well as our child and family services department, recognizing that relationships and how your family is functioning it certainly has an impact on work readiness as well as job retention. And so most importantly, we've also expanded our cultural exploration through classes. These classes help people build community, connect with other peers, and remain connected to our organization. And if a participant completes all of the courses or classes in this soft skills development suite, they earn a workforce readiness certification. Next slide, please. These are some of our FY20 impacts in the area of self-sufficiency through our employment and training program. As you can see, a large number of individuals were served through our training and supportive work services that resulted in a little over 500 individuals starting new jobs, including 201 participants transitioning into work from TANF. Next slide, please. So we understand these impacts are important to track and measure, and I'll take you back to where our journey started more than 10 years ago in thinking about how to describe and track indicators that matter for our participants so that we really can better understand both the impact of the services and how we leverage resources to gain the greatest benefit for our participants. I know this is really small to read, and so I'll just share with you early on, we had identified program measures for each service area, as I described, in child and family, in our recovery services, in our employment and training and TANF programs. And so we have historically looked at things like high school graduation rates, attaining employment, wage increases, family reunification from foster care, as well as families who were able to avoid foster care, and looking at abstinence rates. At the very bottom, I'll note that for our youth services, we have collected an I Matter to People rate for the youth who participated in our Native Youth Olympics. So these measures rolled up to indicators in the organization, and this was our effort to really understand what our collective community level indicators were in the organization. That would be graduation rates, kindergarten preparedness, employment, out-of-home placement of children, abstinence rates. And these drive what we determine to be our core community outcomes. And that's the high school graduation and kindergarten preparedness drive increased equity and social justice through access to quality education and early development. Our job searching and preparedness and entry into the workforce drives self-sufficiency. The family stability and abstinence drives increased health and stability of families, and our work with youth drives increased self-esteem and cultural identity. So we understood that these are important community outcomes for the organization as a whole. What we hadn't done yet was really look at the relationships among these community outcomes in order to be more intentional about how we work better together around those outcomes. Next slide, please. Thank you. And so this led us to measuring multi-generational success. We serve children, we serve parents, we serve families. And so we know we had data around training and education and burial removal in our Tribal TANF programs. In our child and family service programs, we were looking at strengthening family connections and shared that with our recovery services programs and our connections to peers and build a community. And so this helped us start thinking about how we look at data across systems and share data in order to find some early gains, in order to improve the way we work together to support families. So early gains for us were to develop a common intake to the organization, not just to a particular program. And so we've developed that more than 10 years ago, along with a shared release of information intended to encourage collaboration among staff across these various departments and programs. That common intake was intended to be the one place where a participant would have to provide us their general demographic information, and then it would be shared, and then it is shared across any other department or program that they enter in order to ease accessibility. And in the work of our Tribal TANF program and child welfare services, we found some early gains understanding that changes in family structure had a significant impact on barriers and somebody's ability to focus on work readiness. And so in our Tribal TANF plan, we were able to make a change in which we provide short-term cash assistance up to 6 months for parents who've had a child protection services protective placement, the goal of which is to prevent all of those cascading consequences that happen when a placement occurs, loss of TANF, potential loss of housing, those types of things that can lengthen the time it takes to reunify with children. And so we've continued to work together to find ways in which we can look at our shared data and connect our plans and expectations with families. Another great example is families who are participating in our classes or programs are able to use some of that time as allowable activities for their work search. And so that working together has been a very positive, we've achieved some gains through that working together. Another great example is the relationship between our employment and training department that has a childcare subsidy program with our early Head Start program, wherein we have recruited from our TANF population for those childcare positions as we were developing our early Head Start program. We've been able to provide on-site training and helped staff achieve their Child Development Associate certification. That's been certainly a benefit during the pandemic during the short periods where our early Head Start program was shut down was that ability to focus on training. And as we've had staff change over, helping new staff achieve their CDA, which translates to a higher wage. So we've had these small gains through the sharing of data, and recognized that we needed to continue down this path. So next slide, please. Several years ago, we determined in this whole person, whole family organizational approach, we needed to continue to think about how we more intentionally work together to integrate services in order to provide the right service at the right time and understand what motivates families. So we thought about, how do we insulate children and families from the consequences of bad things that happen and increase their protective factors? We have a strong focus on resilience. And how do we understand those protective factors through an Indigenous lens? We wanted to be meaningful for our participants in our community, and Anchorage is a multi-tribal community. So that has been a little bit of a challenge. And we also recognized that we needed to use shared common tools to better understand needs and priorities, not just from each individual service perspective, but for the family as a whole. And we, more importantly, had to understand what the impact of our approach is so that we could continually improve over time and really be responsive to how needs change over time. And so this central question, what moves a family forward, has anchored our work in the last several years. Next slide, please. This is how we've used that question to anchor our work in the development of our whole family, whole person strategies and tools. So back in 2017, we determined that we would identify factors that moved a family forward. And we did this in many different ways. We hired a consultant to do a literature review for us related to resilience and self-sufficiency and peer services. We did an innovation exchange with Garrett County Action Committee, who was doing some really interesting work in their 2-gen supportive families. And more importantly, we asked our staff and our participants that very question in a very low-tech way. We put white paper across the organization with that question, what would move your family forward? We also did some interviews. And we were surprised a bit about the feedback. We did see what we expected to see around education and training and fiscal stability, healthy lifestyles. What came through very clearly from our participants was cultural and spiritual wellness is a key factor to helping to move their family forward towards self-sufficiency. So we went through an iterative process with this tool over the last few years. We operationalized what we thought those things meant and put it back to our participants and got fantastic feedback and changed it drastically. And we are at the point now that we have the best iteration of that tool, and we have implemented it across the entire organization and any program that provides some level of case management. And we've developed a system to collect that data so that it's shareable by anyone providing a service to a family in the organization through the Qualtrics format. So we are, as of FY20, asking people the same questions to understand what they need and making that available to anyone who works with a family. And this is driving our development of an integrated case management model for services. So again, thinking about the right service, right time. We have so many services and opportunities, but we recognize throwing all of those services at a family can sometimes be counterproductive. We want to pay attention to change readiness and motivation, what's important to a family. Next slide, please. So just to summarize, here's how we're integrating services to support the ultimate goal of self-sufficiency. We are anchoring services, our material supports and resources in this protective factor framework that's multi-generational. And we are intentionally using this tool to understand what's important to a family. And we believe this is moving us toward an equity approach to leveraging and mobilizing services for families. We're integrating service delivery across programs. We've now in this year developed a model framework of integrated case management for families who are multiply involved in services or any family that requests it. That will include multidisciplinary team meetings as well as sharing of information. Ultimately, we hope that translates to one plan and shared goals with families. And we have been working for more than 10 years thinking about how to develop a family information system that more easily helps us to monitor and track this mutual data about families. And we have completed in this year the first component of that family information system, which is a participant portal. And I think the timing couldn't have been better during this pandemic because this portal really equips us to engage families or potential participants virtually. So it's a format wherein people can electronically complete applications and signatures, schedule appointments with staff, and we're hoping that this really eases accessibility and helps us to understand what a family wants through the 5 factors at the very start and help us to intentionally work with families around that. So we are in the early stages of that and very much looking forward to what that data tells us about broadly how we leverage our resources within the organization and how we listen to families and work better with them to support motivation and real lasting sustainable change. Next slide, please. Thank you. And my usual disclaimer. I appreciate your time.
Thank you, Deborah. This has been really wonderful. I'm going to hold on some questions that have been coming in for you until we do our third polling question, and then I'm going to jump straight to you right after that. So we're going to get our final polling question. What resources does your organization use to support parents' workforce engagement? Federal funding, partner referrals, childcare subsidies, or other? And they'll pop up on your screen right now. Okay, looks like a lot of federal funding and partner referrals and some child care subsidies. So thank you all for sharing your response. Deborah, I'm going to go straight to a question that Michaela just actually put in the chat box. So you highlighted the cultural and spiritual wellness that's central to families and moving them forward. Can you speak to how you have or are planning to incorporate wellness into engaging parents in the workforce?
Yes. First, by asking them about it. I think asking families about this through our 5 factors assessment opens the door to conversations about it. It can be a little bit challenging because we're not a faith-based organization, but because we heard from our participants that this is really an important part of how to support the wellness of their families, we're asking and responding and acknowledging. We have embraced that as an organization as well, and thinking about wellness in general. I will say in our first effort to operationalize what spiritual and cultural wellness means, we really tried to think about, is it about your connection to other people, your connection to something outside yourself, your engagement in communities, and we abandoned that approach and endorsed more of a how important is this to you? And those are the conversations that we are having with people, and we are in the process of trying to figure out what it is that would support that. As I said, we're offering cultural groups where they're doing activities. We do family group activities where we engage families in subsistence activities. We're going to be learning as we go. But again, I think just asking about it is our first step. And acknowledge.
That's a great first step. There was a related question. Have you noticed correlation between self-sufficiency and cultural identity?
Well, I don't know that we have enough data to talk about that, but we recognize that cultural identity is really critical to children as we're providing services, but also for families. And so we hope to have a better answer to that question in the future.
Excellent. Matt, there was a question earlier. I think it might have just been maybe the slides on not being able to read it, but Carol had wanted to make sure that she was misreading that it appeared that females had a much higher rate of having no change in their jobs than males during the pandemic, and she wanted to make sure that that was her eyesight not being able to see the screen.
Sure, that is correct. It's a small difference, but in these, so these are web surveys. When there's companies that when you're just Googling, there's an anonymous questionnaire that can pop up. And so through thousands of answers, so that's one way to read that statistic, that working dads are less likely to return as usual to their job than working moms. But both groups, it's only like 35 to 39% of the participants are willing to go back to the way that things were before the pandemic. I think that speaks to what some Pew surveys are finding, is that there's this kind of reconsideration of the work-child balance, again, trying to find silver linings in this pandemic, that it might change the way that working parents as a whole consider their work-life balance.
That's great. Thank you so much. And Lisa and Dania, I'm going to give you the last question because we're almost out of time here. Excuse me. So one of the questions that came in was, have you heard of any kind of innovations or kind of things that maybe one state or some local entities are doing to use COVID-19 funding to really kind of hone in on what you were talking about in terms of supporting access and quality of childcare. Or are there any resources maybe people can go to that you want to highlight?
I'm sorry, was that for Xenia?
Yeah, Xenia. Yeah, sorry, Xenia.
Oh, okay.
Sorry. Yeah.
So let's see. For one, So Office of Child Care encourages child care providers to give relief from tuition and co-payments if that's financially possible, especially for low-income families. However, child care providers are not required to provide relief from co-payments and tuition for families in their care during the ARP Act Stabilization Subgrant period. There's a disclaimer page that requires the providers to certify, similar to with the wages, that they will provide relief from co-payments and tuition for families enrolled in the provider's program, and prioritize that relief for families that are struggling to make that type of payment. So we have that as that's one example. And I'm sure like I said, the Office of Child Care has a really good technical assistance network, and we could actually ask them to provide innovative examples across the nation or across our tribal nations, and they would come back with the list. So if anyone's interested, and I'm opening myself up.
Yes. We'll hold you to it.
We could definitely probably get that information and share it and share broadly.
That sounds great. What we'll probably do is everyone will follow up and we'll see if we can get that kind of in a document to post along with the other webinar resources or to different things. So we'll definitely follow up. I'm now going to turn it back to James Butler to close out, and I just want to thank all of our presenters.
Thank you, Louisa. So we are out of time, so I just wanted to quickly remind everyone that a transcript and audio recording, as well as sheets of resources that were covered during today's webinar, will be available in the coming weeks on our Pure TA network website, and you'll see that on the next slide coming before you. And that's the first link that you see. We'd also like to hear from you about any future webinar topics that you'd like to hear about, and you can send that information to the second link that's showing on the bullets. You can also help us expand our network to reach a greater number of people by directing any of your interested colleagues to from your local, state, and tribal networks and agencies to our website at the last link that's shown before you. Want to thank everyone again for your participation in today's webinar. Thank you so much for our presenters. We really appreciate all of your information and input. As mentioned early on, we will launch a quick survey that we're asking you to complete regarding today's webinar, and that will appear in a separate pop-up window when you close out of the webinar. Your feedback is important to us, so we'd like to hear from you. Thanks again for your time today, and we look forward to your participation in our future webinars, which come up monthly. So thanks again, everybody. Enjoy the remainder of your day.